access to health care and affordability shouldn't depend on being old enough to get Medicare or poor enough to qualify for Medicaid. Like one of the previous speakers, I did a lot of surveying this winter down in Windham County, and I've also had a lot of conversations, informal conversations with people about health care. And some of the anecdotes I heard, and this is not statistical, but these are real people, who were not insured because they said they pay the penalty rather than buy. All they could afford is a bronze plan. They would rather pay the penalty because even if they got the bronze plan, it wouldn't do them any good because they couldn't meet the deductible, so they just pay the penalty. Or people who get the bronze plan but aren't actually using it. They're just sort of hedging their bets. They're going to have it in case they end up in a real catastrophe, but they're not actually using it for primary care or preventive care. And then the third set of stories I heard was from people who are on Medicaid who are working in what's increasingly this case in Vermont and elsewhere, what we call the gig economy, meaning they have like several different jobs, none of which offer health insurance, or they're not working in any of them for enough hours, or they're freelancers. And they're basically watching their income to stay poor enough so that they can stay on Medicaid because they have serious medical conditions or chronic medical conditions, and they know that if they got onto Vermont Health Connect, they wouldn't be able to actually meet their health needs on the only plan that they could afford. So these are the kind of stories that I'm hearing when I'm out talking to people in Brattleboro, and to me that makes absolutely no sense on a medical level. As a state, we should be increasing access to care rather than creating greater barriers to care. Increasing premiums is a barrier to care. Deductibles and copays are barriers to care. They're different pockets of money when you're looking at the insurance industry, but for the person who's paying it, it's all coming out of their pocket. This morning I listened to this testimony. I heard a lot about statistics, about insurance liability risks, about adverse utilization, decreases and increases in utilization, positive and negative events, all very heady sort of mathematical stuff. But I want to just remind this board that on the other end of each one of those policies is a person who at some point in their life is going to need health care. And I ask that the Green Mountain Care Board exercise its regulatory authority to deny this rate increase so we don't move further from the goal of health care as a public